Today is April 7th, the World Health Day. The day marks the foundation of World Health Organization, the only organization in the world that gives a damn about your healthcare. This day is also seen as an opportunity to attract the global attention over a major important topic of global health each year.
This year, the theme of the World Health Day is Universal Healthcare, a system that provides healthcare and financial protection to all the citizens of a particular country. Now, as of 2009, around 58 countries have a legislation mandating universal healthcare, and India is not one of them. India instead works on the free healthcare system, which is a publicly funded system that provides general physician tasks and primary health services.
So these are either free of charge or cost a nominal fee for all of its citizens.
And it has no exclusions of income or wealth whatsoever. In 2014, current Prime Minister Narendra Modi unveiled a nationwide plan for universal healthcare in India, known as the National Health Assurance Mission, a plan which was aimed to provide all the citizens of our country free drugs, diagnostic treatments and insurance for serious ailments, but it was unable to pass due to budgetary constraints.
Things are also quite bad in the secondary or specialist healthcare market and the mental health space of our country. India is currently seeing a medical inflation cost of around 15%. And when you figure out such a massive cost, an obvious question arises about the insurance policies of our country. And that is our main topic for the day. So my dear friends, even the 27% of Indians who have medical insurance policies can brace themselves up for what's coming up.
I know you are already feeling bored, so just to keep it short, we are going to focus on only the exclusions related to mental health or psychological/psychiatric disorders. According to the Mental Healthcare Bill of 2017, which was by the way passed exactly 1 year ago from now, that is on 7th April 2017, it was written, and I quote, "Insurers are now bound to make provisions for medical insurance for the treatment of mental illnesses on the same basis as is available for the treatment of physical ailments."
Now, these are the biggest private insurance companies of our country, and after reaching out to the agents or brochures that we got online, all of them, I repeat, all of them have exclusions for mental health or psychiatry disorders. We need to understand that India, even after being such a huge economy, has no insurance policy around mental disorders, whereas our neighbors like Pakistan or Sri Lanka, after being a small economy, they have it.
You can tweet to your Prime Minister about that.
Things get a bit more weird when you read policies from companies like the Max Bupa Go Active Insurance. Like, look at the irony. On the one hand, they provide you policies for a health code service, and on the other hand, they do not have any policy for mental illnesses or psychiatric disorders.
Like typical Indian mindset, डॉक्टर की क्या जरूरत, बेटा जिम करो, डिप्रेशन चला जाएगा.
We knew that the Indian population is stigmatized around mental health, didn't we? But even after knowing about the current status of the nation and the healthcare and the insurance policies, I guess there's a huge mess that needs to be solved.
And the problem is getting bigger and bigger day by day. Like between 2012 and 2030, according to WHO, India will lose around $1.03 trillion just because of mental health issues.
Dude, like I tried converting that figure into rupees and I cannot even imagine the number of zeros in that figure.
And this is just one part of the equation we are talking about. There are huge exclusions like exclusions for STD treatments, exclusions for birth defects, exclusions for policies related to surgery and long waiting periods. Like the list can go on and on. But in the end, I guess it all boils down to us.
We will need to make sure that first, more and more of us actually opt for a health insurance. Then we need to force the companies to bring in these policies. And at last, we need to ask the government to check whether these policies are regulated properly.
Because remember, if we really want our country to have a universal healthcare system,
modification of insurance policies can be the first step towards it.
Insurers are now bound to make provisions for mental. Fuck!